Welcome to Embracing Autism IRL. Today, I have the honor of introducing Dr. Alex Klein, PsyD. Dr. Alex is a licensed clinical psychologist who specializes in parenting as well as assessing neurodivergent adults and children. He currently runs a private practice in Oakland, California, where he does counseling with individual adults, couples, and parents, as well as evaluating adults and children for autism, ADHD, and other forms of neurodivergence. His primary interests include neurodiversity affirming care, parenting challenging children, pathological demand avoidance, also known as PDA, social justice, trauma, education, and advocating for the rights of children. Dr. Klein also uses his experience as a former teacher and school-based therapist to advocate in school districts for more appropriate learning environments for challenging students. Alex, thanks for joining us.
Thanks so much for having me. It's great to be here.
And before we get started, how would you like for me to refer to you? Is it
A-
Alex, Dr. Klein?
Alex is just great.
Okay. So, thank you so much for joining us today. I just wanted to start off by asking you if you could just share a little bit more about your background and what inspired your work in supporting neurodivergent individuals and their families.
Sure. Well, I am a clinical psychologist in Oakland, California. But before going to grad school, was really interested in working with kids. I worked in everything from camps to tutoring to schools. I eventually became a teacher, but one of the reasons why I didn't last very long as a teacher was, I think, because of my ADHD and sort of my recognition of my own neurodivergence, which was emerging. I think that through my background working with kids, but also my experience as a teacher, I realized that I love working with people. A teacher wasn't the right path for me, but I really liked working with neurodivergence, and I really liked learning. It's privileged to learn a lot in the field, particularly from autistic people themselves. So I kind of developed this strong interest in neuro-affirming care, and it's one of these areas that I think as a society we really have a long way to go. But I think for me, it's my heightened sense of justice sensitivity that really kind of inspires me in this work, I would say.
I think it was very appropriate that there was a siren at that moment, just given what you said. um,
Definitely.
so, you mentioned really quick neuro-affirming. For people who might not know what that means, can you just let us know a little bit about what it means to be neuro-affirming?
Yeah. So there's been a move in recent decades, I think, led by a lot of autistic self-advocates in particular. But the term neurodiversity really refers to all forms of neurodivergence. And I think being neuro-affirming sort of recognizes, you know, that yes, these are still disabilities that we're talking about, but there is also a range of strengths associated with these differences, in that sort of only speaking about things in a pathologizing way and only talking about things in terms of weaknesses and difficulties really kind of misses something important. So I think in the sort of neurodiversity movement, we've heard the term different, not less, to describe many adults and children with disabilities. And so, I think being neuro-affirming sort of recognizes the breadth of neurodivergence, and really recognizes how we also want to be strengths-based in the way that we view things.
Yeah, absolutely. It's definitely, I feel like, a new pathway forward compared to where everything used to be in the past. I think that's the future when it comes to neurocognitive disabilities and neurocognitive care. So,
Yeah.
I really brought you on here because I really wanted to talk about PDA, and a little bit on the selfish side because I'm pretty sure my child has PDA. And so I am so curious to learn more, because a lot of
Hmm.
people have never heard of it, or it's just very unknown. I think maybe Europe knows a little bit more about it than we do in the States. But I wanted to ask you if you could explain to our audience what is pathological demand avoidance and how does it fit within the autism spectrum?
Yeah, great question. So PDA, which stands for pathological demand avoidance, and sometimes referred to as pervasive drive for autonomy. Um, it is mostly viewed as a subtype of autism that is not in the diagnostic and statistical manual that we use as therapists and psychologists and in the medical field to diagnose. So it's a neurotype or a subtype on the autism spectrum that was first identified by a psychologist named Elizabeth Newsom in England. As you pointed out, yes, it did come from Europe. And in England, she started noticing like, okay, there's sort of a certain type of kid that's coming into her autism clinic. This is what Dr. Newsom is seeing that don't really fit the typical autistic profile in many ways. And one of the things that sort of defined these kids that she was, evaluating and identifying was the degree of difficulty and avoidance with everyday demands of life, and the degree to which these kids sort of, in order to maintain a sense of control, um, you know, these kids are really sort of avoiding these demands, and sometimes simply just because they were demands. So I think when we think about, what is PDA, I think most people in the field would look at it as a subtype of on the autism spectrum, but again, because it's not in the DSM, sometimes it's spoken to as sort of like a neurotype. And so maybe in a similar way, we might think of something like sensory processing disorder, right? That's not a DSM diagnosis, but that's something that might be really relevant and important that fits you or your child. So that's my basic rundown of PDA.
Yeah, so I was actually thinking about that being kind of similar to SPD because you can't really get a diagnosis of SPD, I don't think. I think it's just kind of like a
Correct.
subcategory of autism, right? So,
Right.
one of the things that parents tend to wonder with PDA not being as familiar here stateside is how do they know that their child may be on the PDA profile, would it be called, or spectrum? I'm not exactly sure the proper terminology.
hmm
Are there any signs that help them differentiate that from just like regular child misbehavior that's just like natural in childhood?
Yeah, I mean, great question because demand avoidance is a part of life that we all experience, regardless of diagnosis, right? So I think one of the things that sort of differentiates PDA is that, again, this might even be things that the kid or somebody really wants to do or is in their best interest, but because maybe it was sort of placed as a demand on them, that is the thing that keeps them from wanting to do it. So, sometimes, I've heard it described as sort of the expectation or pressure from somebody else that leads to that feeling of a lack of autonomy, no sense of control, then sort of that, a sense of anxiety or panic might really increase. And so, again, we see a lot of that resistance to these everyday demands that really kind of goes beyond what we think of as sort of typical stuff, right? So it's to the point where it's maybe interfering with everyday lives, or it's more extreme, or it's even maybe like I'm hungry and that's experienced as a demand to eat, and so then might stop somebody from eating, right? So sort of this need for control might even kind of override other basic needs. And so I think this is one of the things that I think sort of differentiates it from other types of demand avoidance.
Is there a particular age where you might start seeing signs of PDA, or is there an age where they kind of outgrow it? Is it lifelong if you are found to have a PDA profile? How does that work?
Yeah, I mean, again, part of what we're sometimes and not always talking about with when you ask when does PDA show up, or what age might we see it. I mean, again, to the extent that we think of this as a subtype on the autism spectrum, well, those kinds of things can show up as early as some kids getting diagnosed between 1 and 2. I think average age is probably more like 3 or 4, depending on where you are. But I do think that when one of the things that can be a little tricky, because I do sometimes have parents of like a 2 or 3 year old saying like, oh, this feels like PDA. This, I think this is, I would absolutely expect, demand avoidance to be exist in any 2 or 3 year old, right? A certain amount of demand avoidance. So to me, that feels a little early to say like, okay, is this the demand avoidance of the PDA variety? Or is this sort of a, emerging independence and wanting to feel a sense of power? Is this, more of just sort of a sensory avoidance rather than a demand avoidance? So typically, I'd say like 4 or 5 and on up is where, to me, it starts to become a little more clear that this, what this demand avoidance, if this demand avoidance that we're seeing is of the PDA type.
I think that's about the age we really started seeing that type of behavior with our child. So she hasn't
Mm,
been like found or diagnosed with anything, but again, nobody here really acknowledges it for the most part, at least where we've been.
right,
And
right.
for her, the demands is like anything. It's not necessarily doing something she doesn't want to do. It could even be something she normally loves to do, but if you are asking her to do it, suddenly it's a big deal. So I
Yeah,
have a feeling. Does that sound familiar for like a PDA
it's
profile?
it sounds very familiar. I give examples like that. It's like the kid really wants to go to, the park and is excited to go, on the swing. But it had to be their decision to do it, and when it happens and how it happens and who it happens. Whereas if it's like, okay, it's time for us to go, like get your shoes on, let's go. Right now, there could be many types of demand avoidance that interfere with that transition, maybe from house to the park, let's say. But again, I think this sense of like needing to be, the needing to be autonomous, needing that control. That's what really, kind of stands out with the PDA subtype for me.
And when you speak about that, you mentioned some words that really stood out to me. One of those is control, and the other one was anxiety. And it reminds me a little bit of how OCD works. It reminds me a little bit of other like anxiety disorders. Do you feel like this is related to maybe the child having some sort of underlying anxiety or something that is perhaps driving the need to feel like they have to control that answer?
Yeah, I mean, I see anxiety as a very, very common to many autistic kids, sort of regardless of, whether we're talking about a PDA subtype or not. But yes, I think we could sort of interpret this need for control as, among other things, we could interpret that as a need to manage anxiety, right? Because I think the lack of that control creates a lot of distress and anxiety that might manifest as either shutdown, avoidance, lashing out, this kind of thing, fight or flight type stuff.
So, given that, are there any recommendations that you could make to parents who might be seeing these kind of signs in their child on how to maybe communicate with their child during those moments to help ease that anxiety and maybe reduce some of those behaviors?
Yeah, I mean, a big thing we hear spoken about in the PDA community is the concept of declarative language. Linda Murphy, speech therapist who wrote a book about that, and who I would absolutely recommend. And I think that when, so this would be, instead of saying like, look, time to put your thing down, put your shoes on, we're going to the park, time to go to the park, which is more of a demand. Maybe instead it's like, oh, I've noticed the time. I think Nora might be getting to the park soon. Like, oh, I wonder if we're gonna see how high we can get on those on those swing on that swing today, or something like that, right? So you're sort of like commenting on something as opposed to placing a demand on something, right? So I think that's sort of one example of a way that parents can communicate with a child that kind of might make a demand feel less overwhelming. One thing I think about is, how do we not just tell the child what to do when, we're talking about like a transition to the next thing, which is a really common area where many of the kids I see have some challenges. That where we're not really focusing on stopping what they're doing, but we're focusing on trying to tune, attention to the next thing that might be enjoyable, but doing it in a way that doesn't feel as threatening to the child. Because I think that is a really key part of PDA, that there's this sense of, kind of like an overactive threat response or stress response to, again, these demands or perceived demands. So we're really kind of being more thoughtful with our word choices. We're avoiding direct demands like you have to do this, you got to do this, right? Being more kind of flexible in the way that we are communicating, the way that we're negotiating with our kids, the way we're trying to do some proactive problem solving. I mean, all these things are really important ways to, I think, if you have a kid that has that high need for control, we're remembering that they're not choosing to be, they're not trying to be difficult, but they're having a difficult time. And I think if we look for opportunities to give them a win, so to speak, or give them more choice and control, that is really important, I think, in the parent-child relationships, because I think that all these natural ways we have to parent kids, I think a lot of us were parented as just being, more of this sort of demands, like do this, do that. And again, I think the PDAs, help remind us that that does not work for everybody, and we need to really sort of not try to be in the power seat, so to speak, like kind of avoiding these types of power struggles, but really working more as a team with your child. And that does not mean that we let them do whatever they want, whether it's safe or not. It more means we're sort of prioritizing, connecting with them and respecting them over trying to control them. So I think that this is sort of some of the key concepts I think are really important and really can be really hard. I think some of these sound simple, but in practice, in everyday life, I mean, it might be hard to communicate with your, because you at home, we want to get our kid to the next step, like do this, put your thing away, clean your thing up, do your homework, get in the bath, like whatever it is. There's lots of demand, right? And so again, these are kids that really make us rethink how we want to approach trying to get them to do this kind of stuff.
This is totally non-scientific, just like a gut gut reaction. But I kind of feel like since with autism there's a lot of like rigidities and a lot of questioning, like so I don't think I told you, but I was diagnosed with autism a couple years ago as well. And part of that is like just I don't want to do things just because you tell me to. I need to know that there's a valid reason behind I'm doing what I'm doing. Otherwise it feels kind of pointless for me to do. And I
Mhm.
think that that tends to go well with the PDA in the sense that they kind of trigger each other a bit because if you don't see any sense or reasoning into what the demand is, you might be more likely to put up a fight. That's just like my hunch.
Yeah, I love that. That's definitely another element that I think is important. Sometimes we don't get that, where somebody might seem like they're just being kind of oppositional to be oppositional or something like that, or resistant to what we're asking. But really, we haven't done a great job explaining the logic and reasoning behind it, which might be really important for some people to be able to do the thing. So I like that point.
I wanted to ask you too. So, one of the things that I've run into that you kind of briefly mentioned a little bit is just like as a parent, there are these like expectations with like neurotypical kids where, you do tell them, get this done, do this, do that. And typically you get a little pushback, but it's not as difficult as it tends to be with a PDA profiled child. How would you recommend parents strategically tackle that if they do feel like they're starting to get frustrated, or maybe because they've been doing this for years now that, they're more easily triggered when their kid says no or their kid runs away? What would you recommend for parents?
Yeah, I mean, great question, because that is sometimes a complicated answer, and I think some parents have a harder time than others really making the what I see as sort of a pretty critical shift in how we again view ourselves as parents, how we view the child's behavior. I mean, I think one important really thing is the shift from understanding the underlying challenges, for example, a need for control, that is something that is sort of part of your child's neurotype, part of their neurobiology, that is not a choice, not trying to be that way. So it gets into this idea of, it's not that they won't do something that you want them to do, it's that they can't. So I mean, I certainly think that sort of sometimes having a clear understanding of why the kid is doing what they're doing, like that can help change their response in the moment eventually. I mean, I think sometimes parents who are, and in even recently, the Surgeon General put out a warning. I don't know if you saw that, around sort of parent mental health, even recommending that pediatricians in their offices check out parent mental health, because it's been such a big issue. So, I think that sometimes when parents are having a hard time not getting frustrated, I mean, I'm also thinking about, like, well, what's going on for them? Can we get them more support? And what does that look like depending on resources and the particular needs? I think one of the things I really recommend is, a lot of people want to know sort of like, well, you know, okay, in the moment he's doing this thing and it's really agitated, I'm getting really agitated and frustrated, and I want to, make A, B, and C happen, or I just want him to know that, if he does this, this is what's going to happen. And, typically I think helping people to understand that when we're dysregulated, when we're not calm, whether that's our child or us, your child is not going to be able to really take in things that you might want them to take in and understand. So typically, like, once things have bubbled up, that's got to be a cue to pause and try to redirect, and then hopefully later come back, whether that's with your child or whether that's reflecting with your other parent or whoever. It's like, well, why did we get to this place in the first? How did we get to this place in the first place? And how can we prevent that from happening again? I mean, that's a really important focus. So I think that, and similarly, when a parent is starting to, get really frustrated at their kid, that's natural. I think we want to practice self-compassion. I don't expect anyone to be perfectly, patient and calm all the time. But again, how can the parents sort of start to notice their own signs that, like, oh, I'm creeping up, or like, oh, this might might need to tag out a little sooner if I can, if that's feasible for you. I may need to take a 1 minute break and just literally notice my breath, for 1 minute, because that's maybe all you can do, or whatever that is, to, again, try to kind of create a pause before we get to that point where your child is frustrated and then you're also frustrated. Because what we know is, is important when a kid is dysregulated is trying to help co-regulate, or trying to model self-regulation, right? And so this is a really tall order, right? And it could be also reflecting on your own history, right? Like, how were you parented? What happened to you when you started to get dysregulated? So sometimes I think that, these things are complex. So this question of, like, how do we, not get frustrated, or how do we think about that with our kids? So much can go into that, ranging from parent mental health, parent neurodivergence, history of how a parent was parented, and then all these other factors, going into it. So I think, and then again, there's these messages that we've received, about kids, that kids should be, seen and not heard, or, to be a good parent, I must have control over my child, right? These things that sort of are messages that might also be worth being critical around, or reflecting on, to know, maybe there's a different way here.
It almost sounds like there should be a whole other discussion on just that one topic. There's so
Oh
much to
yeah.
unpack there.
Yes, there really
So
is. I agree with
maybe
you.
I'll invite you back again in the future for that.
Great. I love it.
um, so I wanted to also circle around a bit and ask about what specific advice you think you could give parents when it comes to approaching these conversations at the school environment, because it's difficult enough for a parent trying to figure out how to parent PDA child, but I feel like, at least in my experience, when I've brought any of this up with the school, most people aren't even familiar with or have ever heard of PDA. So what are your recommendations there?
Yeah, I love this question. So, one thing that I think is important that I didn't say about PDA, is that typical behavioral strategies tend to not work well for PDAs, right? So, like, if you don't do this, you're going to lose access to this or this consequence, or even reward-based strategies, where, again, I think these kinds of things can threaten the kid's sense of autonomy and sense of control, and create more anxiety, and just not work that well, right? So, I mean, one of the things that I think, this is an area where this comes up for parents that we're, trying to advocate for their kids in schools, where, the school is maybe trying something that's not working that well. Like, like it seems like he's not doing this thing even though he gets a reward, or it seems like she's still struggling even though she has this consequence. And so I think some of this, yes, I totally support sharing the resources about PDA with educators in schools and trying to share the knowledge. But if given that there might not be an embrace of that, but there can be is sort of a pretty practical conversation around, like, well, what actually works for my kid? What is sort of helps achieve shared goals that we all have? And what are underlying challenges that might, even separate from the PDA label, like, okay, his need for control is really, really high. His, and that this was about underlying stress, anxiety, etc. Like, that would be an example of like how we might try to sort of talk about those elements, and how you've noticed that at home or with homework, for example, like when we let him sort of maybe go something that's a little more tuned to his interest, or he's got more of a sense of control over the thing, then or when trying to do something in school, instead of making him talk about one subject, we're going to allow sort of like finding a hook that he's intrinsically interested in, and that might actually work better to still be engaged in learning. So I think that, and then oftentimes, even if it feels like the school is really against you, and I think unfortunately is obviously not always the case, but I'd say often, or at least I come across this a lot, where parents don't feel adequately supported by the schools. I don't blame the schools entirely for that. I mean, I think there's sort of these notions of, of control and compliance that have always been present in schools and in our culture, yet, and then schools are also under resourced largely. So like there's a lot of issues that lead to this. But I think that even when you feel like you're against the school, like often there's one or two allies there. Like there's one or two, like, a speech therapist, or like, oh, that special ed teacher. Oh, the first grade teacher, maybe not the second grade teacher, but the first grade teacher. So like, how can you try and bring some people to the table, literally and figuratively, to, help advocate? Because again, typically we can have maybe one or two people like on a team, so to speak, and then we try to sort of grow that team over time. But it's certainly a battle, and one that I empathize with, I realize.
I think when you mentioned the homework, it kind of made me chuckle internally because my daughter, who I feel has this profile, we have a similar issue where she refuses to do homework. But if I bring out the Mario accent and I tell her, no, 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 Mario's doing homework, suddenly she's like, oh, okay, I'm okay with that. I
Oh,
have
I
to like
love
find
that.
ways to like
I
manipulate
love
it a little
that.
bit.
See, that is using humor, to sort of like, and also you're probably being more flexible. Like, like you're not just saying, no, you got to do it. No, you got to do it. You're like, okay, that didn't work. Saying come to the table. But, if she's interested in Mario, that's again, we're tuning into her interests. I'm saying, like, oh, doing the Mario accent and I'm doing the work. That's a very, that's more of a declarative statement, like, oh, what's Mario? I wonder what Mario's doing, or it seems like Mario's doing this homework now. And then all of a sudden she's joined because she doesn't feel as threatened by that, by that sense of a demand. So I love that example.
Yeah, she'll tell me, I don't want to do my homework. I'm like, you don't have to do it. Mario's gonna do it for you. And she's like, oh, okay.
I love that.
So I wanted to also just ask you really quickly, um, if you had any recommendations for parents who might not know how to approach this with their school. Is there like any resources or anything that you would recommend that they look into on how to approach this? Maybe like a pamphlet that they could bring in, or something that you think that could help them with that conversation?
Yeah, I mean, I know that there are, if you look at sort of the PDA Society in the UK, they've got really good resources for schools. So looking up PDA Society, pretty easy to find online. I know PDA North America is developing more and more school-based resources that parents can bring into their schools. And then there's a lot of other, content creators and, professionals in the field, like Christy Forbes comes to mind. That's she's at Intune Pathways, or Casey Ehrlich at Peace Parents. I mean, there's absolutely lots of people to learn from out there. Yeah. So I think that those would be some of the resources I would direct them to.
Okay, perfect. And I want to ask you what I ask all my guests. Our podcast is called Embracing Autism. What does embracing autism mean to you personally?
Mm. Well, I think it's the conversation I had earlier today where a, a young adult thinking about how, kind of recent autism diagnosis might be integrated into his identity and thinking about and highlighting some of the strengths he has and not just pathologizing aspects. So, like, how can we embrace autism in its fullest, right? How can we see both strengths and challenges rather than focusing on challenges? And also, I think, how can we do better to support families? That there's different ways we can be, there's different things we can do that really, there's another way to be, right? I think typically we have this sort of, what many would call sort of outdated models of where, that you feel like might not be working for your kid, especially with a PDA, right? Like I talked about some of these sort of behavioral strategies, consequence, punishment. And I think, to really truly embrace autism, we really need to recognize that there is a different way. There's a different way that can create better connections with your kid and that can help us move in the right direction. So that's what comes to my mind when I think about embracing autism.
Awesome. Is there anything else you'd like to discuss or share that I may not have given you the opportunity to?
Um, I think I would actually like to say that one of the things that I hear a lot from families is, so some have learned about this concept of a low demand approach, low demand parenting. There's someone named Amanda Diekman who I would definitely recommend, who talks a lot about this, and I really love it. I would add that I think it gets kind of stereotyped a bit into thinking like, oh, well, this is no demand parenting, that this is sort of just letting your child do whatever they want. And I think that that is not accurate. I think it's actually more attuned parenting and sort of modifying your demands to fit a child's abilities. And I think, with a lot of these PDAs, especially, abilities can change, right? Like, so maybe one day they could just, grab their shoes and go out the door because you told them to. Another day, because they've been more stressed about something that happened in school or something, then their threat response is more activated. So, I think it's not so much like always lower demands. It's more like, hey, let's tune into what is the right level of expectation for your child, because because I think that's something that can be hard to see when, a disability such as, autism and PDA is not that obvious to people sometimes, right? It can be kind of a hidden disability. So I do think that that would be a really important concept, that like low demand doesn't mean no demand. It really means like, actually we're sort of recognizing that our child might just not have capacity in that moment, and we're kind of allowing ourselves to meet them where they're at. But again, that's different than never challenging, not helping them to grow, not putting rules. So I guess I want to kind of dispel that myth around low demand parenting, because you hear about this concept of low demand parenting in the PDA space a lot.
That's really insightful. I think that's going to be helpful because I have heard that a lot. And I think that it's not clear to parents exactly what that means, because low demand can mean different things to different people, different ages, different qualifiers. So I think that that's a real good, clear way to explain what that really means. So hopefully our parents out there listening will have learned a little bit more about PDA. Hopefully, if they do have questions, they have places to go, things to see. Among those is a website. What is your website?
Oh, dralexklein.com, DRALEXKLEIN. And again, some of these other resources I mentioned earlier, I think would also be really great. People can get a lot of info there.
Awesome. So you guys heard that, Dr. Alex Klein, and we will have his information listed in the episode description as well if you need the link. Thank you so much, Dr. Alex, for joining us today. This was really helpful for me personally, and I'm sure it will be for everyone else out there who's probably pulling their hair trying to figure out what to do with the PDA profile. So thank you so much.
Thank you for having me. This was great.
Bye.